If your legs tingle, burn, or feel numb when you stand or walk, don't ignore it. It is not always just old age. In many seniors, a simple movement routine can help wake up weak muscles, improve circulation, and ease pressure on irritated nerves. Maybe you have started avoiding walks because your feet feel unsteady. Maybe stairs make you nervous or you worry about falling. That fear is real, and doctors often hear it from adults over 70. Numbness and tingling can come from poor circulation, stiff joints, weak leg muscles, too much sitting, or nerve irritation. Sometimes health issues like diabetes or spine problems play a role too. Today, you'll learn one simple exercise that mobility specialists often recommend to help your legs feel more active and stable. I'll show you how to do it safely, what mistakes to avoid, and why it may help walking and balance over time. And there is one small morning habit that can make this exercise less effective. We'll get to that soon. One common mistake many seniors make is waiting until their legs feel numb before they move. Gentle, regular movement is often more helpful than staying still. Long periods of sitting can slow circulation, stiffen joints, and weaken the muscles that support your hips and legs, which can put more pressure on the nerves going into your feet. Physical therapists often notice that the problem is not only in the feet. Weak hips, tight calves, and limited ankle movement can change the way you walk. Over time, that can make numbness feel worse and make you more afraid of losing balance. Take Mary, a 74-year-old grandmother. She stopped walking because her feet tingled after a few minutes. After starting a simple daily movement routine, she found it easier to stand from a chair, walk more steadily, and move around her home with more confidence. Now let's get to the one exercise many mobility specialists recommend. It helps activate key leg muscles, improve blood flow, and support balance. I'll show you how to do it safely, how many times to repeat it, how to breathe, and how to make it easier if your legs feel weak. The one exercise is the sit to stand sometimes called the chair rise. It may look simple, but it trains many of the same muscles you use every time you stand up, walk across a room, climb stairs, or get out of a car. Mobility specialists often recommend it because it strengthens your legs while encouraging healthy movement through your hips, knees, and ankles. If your legs often feel numb or tingly after sitting, you know how frustrating those first few steps can be. You may feel uncertain, hold on to furniture, or hesitate before walking. That loss of confidence can slowly reduce your activity, and less movement can lead to even weaker muscles and stiffer joints. Here's how to perform the exercise safely. Choose a sturdy chair that will not slide. Sit near the front edge with both feet flat on the floor, about hip-width apart. Your knees should be bent at about 90 degrees. Keep your back straight, your shoulders relaxed, and look forward instead of down. Now lean your upper body forward slightly from your hips. This shifts your weight over your feet and makes standing easier. Press evenly through both feet, tighten your thigh and hip muscles, and slowly stand up. Avoid pushing off your knees if possible. If you need help at first, lightly use the armrests or place your hands on the chair beside you. As your strength improves, try using less support. Once you are standing, pause for 1 or 2 seconds. Stand tall without locking your knees. Keep your breathing relaxed. Many people accidentally hold their breath while standing, but that can make you feel lightheaded. Instead, breathe out as you stand and breathe in as you slowly sit back down. The lowering phase is just as important as standing up. Bend at your hips, control the movement, and lower yourself slowly until you gently touch the chair. Don't drop into the seat. Moving slowly challenges the muscles even more and helps improve control and balance. Start with 5 repetitions if that feels comfortable. Rest for about a minute, then repeat another set if you still feel steady. As your strength improves, work toward 8 to 10 repetitions for 2 or 3 sets, depending on what your healthcare provider recommends. The goal is smooth, controlled movement, not speed. If standing without assistance feels difficult, don't worry. You can make the exercise easier. Place a firm cushion on the chair to reduce how far you have to stand. You can also use the chair's armrest for support or position the chair against a wall so it cannot slide. These small adjustments allow you to practice the movement safely while gradually building strength. If the exercise feels too easy after several weeks, avoid rushing through more repetitions. Instead, slow the movement even further. Count to 3 as you stand and count to 4 as you lower yourself. This increases the amount of work your muscles perform without adding unnecessary strain. Why does this one exercise help so many seniors? First, it activates the quadriceps, the large muscles on the front of your thighs. These muscles help support your knees and make standing and walking easier. Second, it strengthens your glute muscles, which play a major role in balance and stability. Weak glutes often cause shorter steps and reduced confidence while walking. Third, it encourages your calf muscles to contract. Every time these muscles tighten, they help push blood back toward your heart. That's one reason gentle leg movement may improve circulation after sitting for long periods. Fourth, it improves coordination. Your brain, nerves, and muscles must work together to complete the movement. Practicing this pattern repeatedly helps reinforce the coordination needed for safer walking and everyday activities. Remember, this exercise is not a cure for every cause of numbness or tingling. If your symptoms are severe, suddenly worsen, spread rapidly, or are accompanied by significant weakness, loss of bladder or bowel control, chest pain, or other concerning symptoms, seek prompt medical evaluation. Persistent numbness may also require assessment for conditions such as diabetes, nerve disorders, vitamin deficiencies, or spinal problems. Now, what about that morning habit we mentioned earlier? Many seniors perform this exercise immediately after sitting for hours without first giving their ankles and feet a chance to wake up. Before your first chair rise of the day, gently pump your ankles up and down 10 to 15 times while seated. This simple warm-up encourages blood flow, loosens stiff joints, and prepares your legs to move more comfortably, making the sit-to-stand exercise feel smoother and more effective. Before we finish, remember that this one exercise works best when it becomes part of your daily routine. Doing it once in a while may not lead to noticeable changes, but practicing it most days of the week can gradually improve strength, balance, and confidence. There are also a few simple habits that can help you get even better results. Try not to sit for more than 30 to 60 minutes without standing up and moving for a minute or two. Stay hydrated throughout the day, since dehydration can sometimes contribute to muscle cramps and poor circulation. Wear supportive shoes instead of loose slippers when exercising, and keep the area around your chair free of rugs or clutter to reduce your risk of falling. I also want to share one more encouraging story. Robert, an active 78-year-old, had begun relying on furniture to steady himself whenever he stood up. He committed to practicing the sit-to-stand exercise every morning after checking with his healthcare provider that it was appropriate for him. At first, he could only complete 5 slow repetitions. After several weeks of consistent practice, standing became easier, his walking felt more natural, and he was able to enjoy short walks with his grandchildren again. While everyone's progress is different, steady practice often brings meaningful improvements over time. If you experience severe pain, sudden weakness, numbness affecting one side of your body, or symptoms that continue to worsen, don't ignore them. Contact your healthcare provider promptly so the underlying cause can be properly evaluated. If you found this helpful, please take a moment to like this video, subscribe to the channel, and share it with a friend or family member who may also be struggling with numbness or tingling in their legs. Your support helps us create more videos focused on healthy aging and staying independent. Thank you for spending these few minutes with me. Keep moving safely. Stay consistent. And remember that improving mobility is often about small steps repeated every day, not doing everything perfectly at once. Small daily actions often lead to meaningful improvements over time.